Thank you very much. I can't help but tell you the story. My picture was taken on the stage of a San Francisco theater when I was addressing the Critical Care Society, and was published the next day in the San Francisco Chronicle. Not a word about the great speech I gave, just showing me like this, and it said, "Looks like Lincoln, sounds like Moses." Well, let me say at the outset that I realize that in this land, which is somewhat crazy about rights of people to almost everything, we have no evidence whatsoever that our founding fathers passed down any documents that even hinted at a right to health care. Unless one thinks, well, perhaps you could stretch things a little bit to have it included in the inalienable rights of life, liberty, and the pursuit of happiness. And yet over and over again, the voice of the people of America have said in polls, we want health care to be a right. And so I would suggest that we accept health care as a moral right. Well, good evening, ladies and gentlemen, and thank you very much for coming to this very special occasion. I'm delighted that this was an opportunity when two old friends could act as masters of ceremony, master and mistress of ceremonies. There were three people in Washington that earnestly sought that I be Surgeon General. One was Ronald Reagan, the other was Jesse Helms, and the third was Orrin Hatch. But I can tell you, all three of them working together couldn't have done it, but Orrin Hatch practically accomplished it alone. And in the manner in which he treated my wife during those awful 11 months that I was waiting for confirmation, made it very clear that chivalry was not dead in Washington, and it was one of the reasons I stayed on here and didn't go elsewhere looking for a job. As far as Hillary is concerned, I had some wonderful times with her. She frequently referred to me as her mentor, but she was also my counselor in many of the projects that I espoused, and we counseled each other. And the most valuable thing that Hillary could ever have given me was her friendship. And she did give me that, and I'm grateful for that, Hillary. Now, I've been asked to say a few words about the future of healthcare in the 21st century, and that in itself is a pretty good laugh. But I'm sure that you know that we talk about the vision of healthcare. It can mean several things. It can mean, first of all, what we can see, but it also means what we would like to see. Now, I can't see a tremendous distance into the future, and that does worry me a little bit, but I would like to limit my remarks, therefore, not to what I can see, but what I would like to see. I do thank God that my vision's a little better than some 90-year-old fellows that I know, but I still can't see too far. But I can easily imagine a speech given in 1906 where the speaker was tasked with the idea of predicting the changes in medicine and health for the 20th century and how far short he would have fallen about what really did happen. And so with that in mind, I will not focus on what I can see, but really what I want to see. As I reflect on the 6 years of career that I have spent, 6 decades I have spent in public health, I cannot help be awed at tremendous accomplishments that have taken place, but also to be somewhat shocked at what has not taken place. We can do better, and we must. The diseases that not long ago were death sentences have now been largely conquered. And we all know that many preventive strategies, on the other hand, not only those, but those for the diseases and disabilities when they do break through, are all but ignored and sit on shelves. Our healthcare coverage net has gaping holes in it that leave 45 million without health insurance, and that hurts everybody. And as I said, we can do better and we must do better. Through most of history, medicine could not and did not accomplish very much. And the concept of science-driven public health had never entered anybody's mind. But by the early 20th century, we began to see what people called modern medical miracles, and they were both in the field of prevention and in treatment, and they began to emerge together at an ever-increasing and accelerating pace. The average lifespan increased by 20 years, which means that most Americans live into their 80s, and some of us are pleased enough to live substantially longer than that. And as you listen to these words that I'm saying, there are potential transplant patients who are dying while they wait for an organ which they could have had if we had a better distribution system. We could provide that with very little effort. As you listen, 20 people who are tobacco users will die before I finish these remarks. And millions of people are crying out from all over our land from untreated pain. An aging person is going through a debilitating fracture of the hip because no one told her how to get up out of a chair. And a driver under the influence of an addictive drug, probably alcohol, has hit a pedestrian and either maimed him or her for life or killed that person. And when people who are addicted to drugs go to medical care for help, they are told to get in line and wait for a slot of treatment to open up. Obesity and its associated problems, including diabetes and heart disease, continue to expand across our entire nation. Our preparedness for potential influenza, pandemics, bioterrorism, and its aftermath, and the next HIV/AIDS epidemic are not advancing at a pace that will make us prepared for those medical emergencies when they do come. I could go on, but I believe you get the drift of what I'm saying and how I feel that we have come to a sorry and unacceptable state of health and health care in these United States. In all of these cases I've mentioned, and I could mention more, that the means do exist to take care of the problem right now and treat it effectively. Our capability to treat disease is great, but unfortunately, our willingness to equitably deliver that health care is rather weak. I would like to relate to you 4 case histories very briefly, and I do so because each carries a story of promise, of peril, and of unrealized potential. And I find that they do offer something to those who are looking forward to a vision for healthcare in this century. First, let me tell you what it was like to be a pediatric surgeon in the 1940s. The specialty was in its infancy. Children died because they were treated not as children, but as miniature editions of older people. And the others were not even offered medical intervention by a surgeon because it was considered that operative procedures were riskier than were the diseases that warranted that they be done. And general anesthesia, especially for small babies, was Russian roulette. And yet, dedication to the unique needs of these youngsters, respect for their humanity, and perseverance to overcome the innumerable obstacles brought advances beyond the dreams of many of us in the 1940s. I was fortunate enough to have the opportunity to take part in that and to participate in that revolution. And as I reflect on my career, my part and contribution to that area, especially in neonatal surgery, is one of the things from which I get a sense of fulfillment every single day of my life, even this many years later. Second, let me remind you of the not so recent, not too long ago, early days of the HIV epidemic. This public bombshell struck America in the earliest days of my assignment as Surgeon General. And the enormity of the medical challenge was compounded by fear and by downright disrespect for many of the people who were victims of this disease. In the first 2 years of the epidemic, public health and medical intervention took back seats as stigma, fear, and politics seemed to rule. And we were quickly able to determine, however, the major modalities of transmission. I remember going on television nationally and talking to people on how to avoid AIDS, and that included the use of condoms, which was up until then something people just didn't talk about. I was criticized very sharply for that by those who argued that people who contracted this disease through playing with intravenous drugs or having extramarital sex or sex between people of the same gender really did not warrant assistance from the medical profession, and that actually my comments about them might even foster such behavior. My response was simple. I said I was the Surgeon General of all the people. And I worked with NIH to advance research, with CDC to advance prevention enhancement, and with FDA to expedite treatment approval, with the pharmaceutical houses to provide actual treatment, and with many philanthropies in order to take care of the gaps in funding, and the advocacy groups and organizations around the company just to keep us on track. And a remarkable coalescence of leadership in Congress and the White House came together and contributed to transforming this disease from a death sentence in the 1980s to a treatable and preventable disease in the 1990s, with many afflicted now living productive and fulfilling lives. Yet even as progress continues along these lines, we have much to do to address ongoing disparities. HIV transmission is not the same in all populations, and the differences are probably related to lack of access to education as well as to actual health care. But there is no reason at all why HIV in the 21st century could go the way of smallpox in the 20th. But it will take this eminently feasible operation will take leaders here and abroad to put health, well-being, and respect for all people, regardless of their color, their creed, their persuasions, their locations, or their education, as the highest goal in medicine. Third, tobacco is another area where science and medicine have advanced profoundly, but on the other hand, policy and leadership seem to have lagged behind. This deadly and addictive substance accounts for nearly 1 in 5 deaths in our country, and I can still remember predicting in the early 1980s that if something didn't change quickly, that the number of deaths from lung cancer in women would soon exceed the number of deaths from breast cancer. And I said it would take place by 1990. Unfortunately, I was 3 years off when that grim milestone was reached in 1987, and lung cancer continues to climb as a disease among women. Quitting smoking, whenever you do it, dramatically reduces the risk of illness and death, time away from work, premature babies and low birth weight babies, and it supports the tobacco prevention efforts that we make with our children. For tobacco, as with any other addictive drug, we have to achieve a status in this country where treatment for the addiction is just as available as is the substance itself. A special challenge with tobacco is that death and destruction by tobacco are spread by corporations that put greed and profit above health, ethics, and even common decency. And actually, they are unchecked by any regulatory oversight, and they continue to modify their product to make it more attractive, to make it more addictive and actually spread false health information using lies such as misleading labels about light and low-tar cigarettes. There is now an international treaty that attempts to control such practices, has been ratified already by more than 130 nations on this globe, but unfortunately not by the United States. We could make tobacco-related disease in America as rare and unusual as it was a century ago, when doctors would travel great distances just to see the very rare and unusual case of a woman with cancer of the lung. And finally, let me turn to some of my more recent experiences in healthcare reform. In the early 1990s, I worked with President Clinton and with First Lady Hillary Clinton on what I hoped would be a bipartisan effort to really reform healthcare. At a White House meeting, I remarked that our healthcare system was indeed remarkable, and it may function at times with compassion, at times with competence, and at other times with sheer excellence, but not for enough Americans. For many Americans, our healthcare system is a tyranny, and that means that for them, it is more a curse than it is a blessing. Unfortunately, that bipartisan effort was overwhelmed by party politics that killed it and offered very little in its place. The number of Americans today without health insurance has continued to grow. The toll increases on our nation's health and productivity, especially on the hospitals that must provide emergency care, and on the economics of many corporations, both large and small. There are no simple answers to these challenges, but let me offer to you some core principles to guide the transformation in healthcare that I seem to think is so obviously necessary. First, let me clearly affirm a fundamental right to all people to have the highest standard of healthcare, both through preventive medicine and appropriate medical treatment and disability when disease does break through. Second, disparities of healthcare, be they based upon age, gender, ethnicity, sexuality, liability, disability, and characteristics that you can mention as well as I, these are absolutely unacceptable and are at odds with the right to health. Third, the highest priority of healthcare provides both public, private, and health-related agencies, including CDC, NIH, FDA, and it must be the improvement of health and well-being of all people through disease prevention and health treatment, with disease prevention taking a far greater role in the future than it has in the past. As I reflect on the 20th century and consider the 21st century ahead of us, I must conclude that the absolutely incredible advances of the last century will pale when we see what is produced by the 21st century. But those are days which still lie ahead. However, let me say that I am still concerned that the present difference between the haves and the have-nots will worsen. Consider just two telling facts. 80% of those in this country who are not insured belong to working families, and 20% of the uninsured are children. Now I ask you, can we reasonably blame their lack of access to health care on them? My plea is that we enter this century striving for what is possible and obligatory from a humanitarian prospect, and that we view the right to health care as well-being along with the most fundamental of our moral rights. Disparities in health care must be addressed with urgency. They threaten more than just physical survival. Failure to provide fundamental resources such as clean water and air, education, health care, are not consistent with what I think of as America. We should set a goal that significantly reduces disparities and provide health care for all within this first decade of the 21st century. Now, that will take a tremendous and radical change in what we do, and it certainly will not be the usual election cycle Band-Aid treatment of our problem. I do not intend to make this a partisan issue, nor do I expect to blame one part of the government for all that our problems present, because that would be neither productive nor would it be true to history. But politics should serve health and not the other way around. I am convinced that our growing healthcare crisis can only be resolved with the concerted effort of both major political parties in this country. And I urge the President of the United States to work with leaders of Congress to appoint a bipartisan commission with input from major health organizations, public and private, from anybody in this country with a remote or intimate interest in, stakeholder in health or health care, and to develop a plan towards the fulfillment of the goals that I have just articulated. And I urge health professionals and their professional organizations, foundations in the private sector, to support efforts that look at the 21st century from beginning to end as a vision for better health for all people. Finally, I urge that we focus on healthcare issues in America, as we do focus on them, that we also consider the global context of our actions, and particularly to try to raise the standards of health care, which will be health eventually, globally. By committing ourselves to contributions to world health, we not only demonstrate benevolence and leadership, but we contribute actually to a healthier America. But in a cautionary word of conclusion, I should say that the greatest factor shaping the future of healthcare in America will be a surprise. I don't know what it will be, because it will be a surprise. A surprise that will transform healthcare as we know it. Now, why do I say that? I say it because I do have 90 years of experience of living into the future. And I learned that what you plan and what you think you can assume are almost always changed by what comes along to surprise you. The greatest surprise I've had so far in the 21st century is that I got to see it at all. Now, surprisingly, I've already lived 6 years into the 21st century, and one never knows, I might even have a few more. Thank you.